subscribe, and welcome back again, guys. Enjoy.
That makes sense.
Yeah, very, very much. So someone asked, what triggers depression?
I would say that depression, I'd call it like an emotion. So as human beings, we have three things that are common for everyone. We have thoughts, we have feelings, we have behavior. So from my understanding, many things begin with our thoughts. Like how we think will determine how we feel. So when you're feeling like you're depressed, meaning like you're low, you're sad, you're down, then you need to check what are you thinking about. It could be you're thinking that this situation I'm in is too much for me, I can't take it. And because of that, now you feel really low. Maybe you feel helpless, maybe you feel down. It could also be that you think this thing that happened was not fair and I have no way of getting justice, you know. So it's like, again, you feel like you're frustrated. That can also make you feel depressed. Sometimes we can also be depressed like because of the life situations, like losing somebody. So it's very normal, like when you're grieving, you may experience depression. So but also again, even that, it still goes back to how you're thinking about things. So the moment you're able to change your thinking patterns, sometimes we assume the worst, we expect the worst, even if the worst is not coming. Sometimes we think it's hopeless and maybe there's a way out. It may make us feel depressed. But for the grief maybe may not necessarily be about your thoughts. Depression caused by grief is because of the sadness of the loss, which is expected and it's very normal. Only that depression should not last for more than 6 months. It becomes a problem if you realize like for 6 months straight you're in that low mood, then that's a problem. But if someone has recently died, or a relationship has ended, or a job loss, or you've lost money, it is normal to feel low for a while. So other about depression is that mostly it increases when we are on our own, because you know when you feel there's no way out, it's just you by yourself thinking there's no way out. But perhaps if you shared it with someone else who is not feeling low, they could actually help you with alternative ways out. So that's why when you're starting to feel low and then now you withdraw, you're not talking to people, you find that you get worse.
But I have a question. How will someone know that this is the right person that I have to speak up to? You know? Because it's really difficult to get that very one person that you can, get to understand very well, or maybe someone who is able to keep your secrets, So how are you going to know that this is the right person that I'm going to talk to?
Yes, indeed, that can be a hard thing to determine. Usually, perhaps you can use past experience and see that in interaction with this person, how do they talk about other people who have shared a problem with them? Do they just carelessly reveal people's secrets? And also, do they minimize ama kudharau, like wanaona hiyo kitu ni ndogo na inampatia stress? Just how people talk and how they talk about other people and how they comment about situations can help you to gauge, is this person safe? Are they safe in terms of, will they keep this secret, and are they safe in terms of, will they actually help me or they'll make me feel worse? So if you totally find that it's very hard to find someone to talk to who is safe, then that's when now we are also available to you as counselors. That's a space where you can go and say where you're stuck, and somehow you can get some help.
How do you manage to acquire the attitude of patience, since that is most required as a counselor?
As a counselor? Okay, patience. From my experience, there are some things that, there's some qualities we have that nobody taught us. Perhaps we were born with them. Like everybody is good at something, and everybody has some good qualities. So one of the things about being a counselor is you may find that, what are your natural qualities? Are you patient with people? Like for example, for me, even before I became a counselor, I noticed that I am a very good listener. Like I give people attention kabisa, all other things aside. And another thing is you also learn it in school. You see the difference between a professional counselor and any other person who can listen to you is that this person has gone to school. So counseling means this person has been given the skills of how to really listen to you without getting distracted. So it's both, it's a combination of qualities that you're born with and a skill that you actually learn.
Since you've said some qualities you're born with, and we understand that depression is kind of disease, right? So do we say that some people can be born with depression?
Okay, this is a
or
very
maybe it's inherited, you know.
or maybe it's inherited.
Yeah, from one person to the other. Maybe this person was depressed, then the other person is also depressed, and then can it be inherited?
Can it be inherited? Yeah. Actually, I smiled because I'm like, this is a very, call it like a controversial topic.
Yeah.
Kukubaliana may be a problem. Now you see about inheritance. When you do like a family tree, if you decide to draw a tree of your family, your grandparents, great grandparents, like different generations, you may notice that it could be that depression runs in this family, and then you're like, no wonder even I have it, like sikupenda kwangu nimeipata. And you see, other than depression, there are many other illnesses and even behaviors that you may find are following a pattern in the family. This does not necessarily mean that it is unavoidable. It could mean there are things you may check, other than the person having depression. You may check what were some of the qualities about this person. Is there a common thing about what to call family when you're on a depression? What is it about them? Yeah, because many times we catch patterns. We catch patterns, not necessarily catching the disease, but the pattern. Like maybe if we have a culture of not sharing, like nikiwa na shida, even my siblings do not know, my parents do not know, I keep it to myself. Maybe you saw it from your mother, and maybe your mother saw it from her mother. But kumbe, the only secret is if you share, you're not gonna get it. You know. So it's very important for us to do those family trees and trace things that are common. But in addition to tracing what is common, it's good for us to consider, are there patterns of behavior or patterns of response or dealing with stress or discomfort that this family may have been repeating that is making the depression to run in the family. Secondly, as more research is being done, we are learning more and more that our brains can change. They are not fixed. So before, when we say like you have this illness, a disorder, and it cannot be healed, now there's a new concept, something called neuroplasticity, saying that your brain can change. So the moment your thought patterns are able to be changed, then you find also that feeling of being depressed can actually change. And now, even when someone is severely depressed to a point that they are taking medication, the practice that we're encouraging now is, as much as they take the medication, they need to also continue coming to see a counselor, because as they do both, they reach a point where they realize they may not need to continue taking the medication. So depression, for me, even from experience with some of my clients, and based also on research and more information that's coming out, is that it's not a permanent, it does not have to be a life sentence. Like now I caught it and this is it. You can always do something about it and it changes. And for that, about the family, I said that it may be passing down not because it's in your system, but it's because it's in the behavior and tendencies of people in that family. I hope that is clear.
It's so clear. And I think it's very interesting because at some point I thought maybe someone can be born with depression, or maybe, I don't know, it's just inherited from one person to the other, you know, like maybe from family members, this one had depression, so the other one is also having depression. So thank you so much for telling us about that.
And again, you see, in light of the changes that you can make, is to say that indeed, research also has shown that when you're in the stomach, like when your mother is carrying you and she is stressed out, or she feels like she didn't want that pregnancy, it can be that now you get born feeling like you're unwanted and you're feeling very low.
For real?
Yes, for real. And women encourage the women who are pregnant to start talking to the babies in the stomach because it affects them. And to add is that, I mean that even if that is the situation you found yourself in, and you're now tending to be very low and very sad, it does not mean it cannot change. It can change. So we are constantly capable of changing. That if you change your environment, or you change your tactic or your approach to things, it's possible actually to overcome depression and any other and many other mental health challenges. Yes.
Wow. Did you guys know about that? Just drop a comment. We are having a very beautiful conversation here. Drop a comment. Let's know your views about what we are talking about here. Okay, so Kami, the next question is, what methods and tactics do you use to ensure that your patients are speaking out over what they're going through?
So in counseling, we actually call them clients, not patients.
Okay.
No, it does not mean you're sick or you have a problem. It just means you're a normal human who's facing a challenge, and then you're seeking professional professional help to address the challenge. Yeah? So we call them the client. Just repeat to ensure that
they are able to speak out.
That they are able to speak out.
Yeah, about what they are going through.
Okay. So there are three things. We call them three core conditions. One of them is zero judgment. The other one is empathy. And the other one is unconditional positive regard. So these three things are like the foundation of counseling. And any professional counselor you visit will give you those three things. And what we have seen that promoted those three conditions is that any person who is given those three things will end up getting to a place where they feel safe and where they feel they have been accepted regardless of anything. And with that, they can open up. And other than opening up, because in counseling they're not going to be given advice, they are able to reconsider some of their actions and some of their thoughts and even beliefs in just that environment. Because you see, what makes people not talk, like you asked me about if you're depressed, how do you know this person is going to be safe? One of the things that make people not talk is when they feel
they are unsafe.
Exactly. That maybe this person is going to see me like I'm stupid or like I'm not making sense or I'm exaggerating. But you see, in the moment that they find that they're in a place where anything they feel is allowed, then they start feeling like, okay, this person gets me. So they will talk. And again, this is not to say that you're not going to be challenged in counseling. You will be, but you see, at first you're just given the space to be yourself, and we are more about being curious rather than criticizing or judging. So even if I see you like this and you say, like, I feel stupid, it will not be like, what's wrong with you? Why do you feel stupid? It will be like, tell me, help me understand what is making you feel stupid. Like, I'll be very curious. And you see, as I'm curious, and I'm also pushing it back to you, together we explore until we realize, oh, kumbe, this is why I feel stupid. Then you realize, oh, so this is what I can do to stop feeling stupid. So there's no judgment in counseling. Whatever you've done, whatever you think, whatever you want to say is allowed. Number two, there is unconditional positive regard, which can also be said to be respect. So there we don't consider what is your title, when you mama nani, baba nani, when you see, oh, I'm already pastor, where to get truth, you know. And when you feel that way, again, you start feeling like you're safe. You're safe to be vulnerable, safe to disclose your weaknesses and some of the things you've done that you don't believe it was you. Then with empathy, we get into your world so that we understand, you know, I did this because this is what I was thinking, this is what I was feeling. We get into your world temporarily. Yeah. So those three things, when they're there, you find that many times patients or clients will open up. And I also want to add that a client who has been betrayed a lot may be very cautious. But you see, a session is not one-off. You will not come for one session. Many times you'll come for more than one. So you find that as you build this trust with the client, they open up more and more as you continue. So day one, they may say this little. Day two, but you find by the third time, they are free to open up. As long as there's consistency that this is a safe space. Yeah.
The other question was, during sessions, sometimes clients develop some challenging behaviors and distractions. So how do you manage to handle such behaviors without, making them feel like they are not worth to be cancelled?
Okay. Yeah. It's not like there's a standard way of dealing with these things sometimes, because, we are very different and anything can happen in a session, you know. So most of the time what we do, we first allow the client to be. Yeah, because as they do whatever they're doing, it is probably because of something. Like I said, with us, we are always curious. We are not judgmental, we are curious. Like if you're throwing that bottle, or if you're on your phone and you're in the session, how come? What is making you do that? It could be that maybe you're nervous, maybe you're anxious, maybe you're uneasy, or maybe you're hurting so much that you're looking for a distraction. So we let you be, you can do it until when you get tired of it, or we can talk about it and put the attention on whatever is distracting you. And with time you find that when you do that, it raises the awareness of the person that, anyway, why am I doing this? And they may change their mind.
Our last question, Kami. What are some of the qualities and skills needed for one to be a mental health counselor?
The qualities will be like, you need to be a very good listener, an active listener who pays attention to what the client is saying. You also need to learn how to separate yourself from the client, so that when you're with the client, it's all about them all your issues in a back kwanza for the time being. You also need to be a person of integrity, so that when you're there assuring the client that you keep their confidentiality, indeed you keep it, you know. You also need to be a person who is open to learning, because like I said, we are so different and you don't know what the client will bring. The situations they are as unique as the number of people, and which calls for you, even after having a session with the client, many times you need to go do research, do more reading about it. You also need to be a person who naturally cares about other people. Sometimes people feel that we are all about the money because you'll be asked to pay for a session. So you're like, hey, why is it just about the money? I actually realize it's not possible to continue being a counselor if you don't care about the people. So many times you need to have that humane and a general concern to see people grow. And these are just some things that are qualities. However, when it comes to skills, many of the skills you're taught in school, like even how to show empathy, that is a skill that you learn. Even how to observe, because sometimes people talk with signs, you know. Someone may be laughing, but really that is pain that is manifesting. So you learn how to be observant, you learn how to empathize, you also learn how to just handle different kinds of people, of different kinds of ages and different kinds of experiences. So that's what I can think of at the top of my head, based on what you're going to have to deal with.
Wow. Okay.
Yeah.
So the other question is, someone can ask, like, what's the difference between a psychologist, a counselor, and a therapist?
Okay. So now with psychology, psychology is studying about how the brain works, how the brain functions. So if someone has only done psychology, it means they've only done the scientific bit, which is how does your brain function. But now when you add counseling skills, it means that as you understand how the brain functions, you also learn how to help your client understand, and then now you're able to offer them social support. Like you're there for them to allow them to process the emotions that they are feeling and the struggles, and then you help them to see how they're going to get out of it. But you see, if you're just a psychologist, your work will just be to profile somebody and say, well, according to your behavior, you have childhood issues, you know, but you're not telling them, okay, so how do I deal with it, you know? So that's the difference. So a counseling psychologist, a counselor will combine psychology and social skills. Then a therapist and counselor can be used interchangeably, only that you see there are different kinds of therapists. As in, for us, we are like therapists who are working with you, like in terms of hearing you out and helping you out. But now you see there are other therapists like who help you with other like physical issues, you know. But for us, it's therapists for your mental issues. So therapist and counselor are interchangeable. Psychologist, I said, is only science. Then now for me, when I say I'm a counseling psychologist, it's just showing you that I'm combining science with
the counseling.
The counseling.
Wow.
Yeah.
That's so awesome. Yeah, guys, so I think that's it for today. Do you still have something
I wanted to talk about a psychiatrist, because sometimes people think that counselors are doctors, and they think that a psychiatrist and a counselor is one and the same thing. So the difference is that a psychiatrist is somebody who has first studied medicine, so they're a doctor, and then now they focus on the mental challenges people have. But now for them, they use medication to deal with it. So if you have anxiety, unapewa dawa ya anxiety. If you are depression, unapewa dawa.
But still, do they have to talk to you first? Maybe they counsel you first before they give you those medications.
So you see that the psychiatrist does not counsel you. So that's why you see they don't have the element of the counseling, the social. Now as we do, because we want to hear your story, we want to hear your current scenario, and we want to help you with it without you having. So you see them for the medicine, they are only dealing with the symptoms. That I'm anxious, I can't sleep, I can't rest, so you're given something to calm you down. But you have not dealt with what is causing you to be anxious. So for us, we are more concerned with what is causing you to be anxious. But I said, when a person is at a severe state, like they are not able to function, then we can combine that. They can take the medication, but they still come to us to understand, so that it's more long term. Again, because those medications come with side effects that may be very uncomfortable. So when you come to see a counselor, they are not doctors. We are not going to give you medicine. We can only maybe refer you to be seen by a psychiatrist if we are seeing that the scenario is so severe that you are unable to go about your normal activities. And this has been persisting for more than 6 months.
Wow.
Well, that's the end of the video, guys. I hope you enjoyed. Kindly go subscribe to Endeleo Counseling Therapy and you'll get more information about mental health issues. And also, don't forget to give this video a like, drop a comment, share with your friends. I always say that we are not just making videos, we are also changing lives. And by sharing, you're helping us to change the lives of our loved ones. So, without much further ado, allow me to say we are peace out. Thank you.